What's the difference between dissociation and psychosis? There are different terms that people may have heard about or may even have experienced, and they're not exactly sure what it means. There are some dissociation experiences like derealization, depersonalization. How do those differ from psychosis, from an actual psychotic process? I'm going to talk about that in this video today. I do a segment here on my YouTube channel, Dr. Seth Psychologist, where I explain the psychological processes of complex minds. And so I'm going to do that in this video when I explain the difference between dissociation and psychosis. So let's start with psychosis. Psychosis is a psychological experience where a person has a break with reality. They lose contact with reality and they may experience delusions, which is beliefs that they know are true but are not, or hallucinations. They could be auditory hallucinations, which is hearing voices, or they could be visual hallucinations, seeing things. In my clinical experience as a psychologist of over 20 years, I can share that auditory hallucinations are far more common than true visual hallucinations. But in addition, a person who has psychosis could also have extremely disorganized speech or behavior, as an example. So, those are a few things that come with psychosis. But the most important thing is it is a loss of contact with reality. They have lost contact with a critical component of reality, so that what is real is actually something that they do not recognize. What they see, what they perceive, they know to be true. They are 100% sure that their experience is what is the reality, even though it's not. Okay. So that is a sort of simple peripheral definition of psychosis. Now, what is dissociation? Dissociation is less severe in many ways than psychosis. Dissociation is a disruption or a disconnection to some extent of an important component of a person's thinking, perception, feeling, or memory. It is a disconnection or a disruption in it, but not a loss of contact with reality. So you can tell in that way how it is less severe. With psychosis, a person doesn't know that what they're experiencing does not match with reality, that it is not in line with others' perceptions of the same exact thing happening. With dissociation, there is still some acknowledgement of reality. And yet, at the same time, there is a disruption in an important thinking or feeling or perception process that the individual is having. And I'll give a couple of examples. With depersonalization, for example, the individual has an experience, a really strong, intense experience where they feel that they are out of contact with their own body. Depersonalization. That makes sense, right? The word depersonalized, like they are separated in some ways from their person. Okay. So they feel like they are out of contact in some way, detached from their own body as they go about their day, as they feel their experiences in the world. With derealization, the individual does not feel out of touch from their own body. They actually feel like they are in their own body, but they look around and they feel disconnected from the world around them. So, one example is sometimes people with derealization will tell you that they feel as if they are plopped into a movie. Like they are living their life, they're in the room or they're walking down the street, but they don't feel like they are doing it normally. They feel like they look around and around them they see a movie. And they are actually in the middle of a movie. There is this perception that life is not real, that they are not connected to life in a normal way. This is derealization. As an example, I can share having been on the Nancy Grace show and talking about a legal case in which a particular individual's psychological test results were being reviewed in court. And I shared commentary on what particular test results sometimes can mean. And in those particular test results, we talked about derealization. And I talked about how the individual, when they are experiencing this, feels like they can be in the middle of a movie. But here's what's important. When a person has derealization, it is not a loss of contact with reality. They actually feel that way as if they're in a movie, as if life is dreamlike. They're in the middle of a dream or a movie, and yet they know that that is not true. So that is an important difference. When we talk about derealization and depersonalization, which are examples of dissociation, I shared that there is not loss of contact with reality. The individual has these feelings, these experiences, but at the same time, they know that it's not reality. This marks a clear distinction between psychosis, where the individual has lost contact with reality, with the critical component of reality, and dissociation, where there is simply a disruption in one's thinking, one's perception of something, one's feeling, but still they acknowledge what is real and what is true. I will just give a quick example. When someone is in the middle of a psychotic process, someone is psychotic, someone who is paranoid, for example, may have a paranoid delusion that someone is contaminating their food, poisoning their food. They are certain of it. They know it's happening. And as a result, they will not eat. Sometimes they may not eat for long periods of time because they know it's happening. Well, that is a break with reality because in that case, for example, no one is poisoning their food. So the important distinction here is about the degree to which one can still hold on to reality, okay? And also the degree of insight. So we would say with dissociation, someone who has an experience where they feel like they're out of contact or connection with their own body, when they know that that is not actually truly happening, that they can still see reality around them, they still hold on to insight. They have greater insight into what is happening than an individual who is psychotic, who actually doesn't have the insight that what's happening is not real. Okay. Those are some really important distinctions. I know it's complicated, but I hope that this made sense for anybody who wants to understand the difference between psychosis and dissociation. One quick note that I want to make is that a lot of times dissociation can be triggered by stress or traumas. That these experiences can flare up when an individual goes through really stressful events, stressful life transitions, or traumatic events. This can trigger this sort of dissociative experience. Another quick superficial note that I want to make about dissociation is that a lot of times there's a myth that it is disassociation, that is what we call it, that is the term disassociation. You may hear a lot of people talk about the term disassociation or disassociated. Actually, the word is just dissociated. There is no A. It is not the full word association. It's dissociation, dissociated. That is actually the correct term and the way to pronounce it. Finally, when it comes to psychosis, stress can also trigger psychotic flare ups, but at the same time, psychosis is an organic process and actually, a lot of times, can be really unpredictable. It is an organic process. It is different than dissociation in that way. Dissociation, which can be triggered by more stress, more event related issues. All right. I hope this has been helpful. If it has, you may find some other videos that I have on my channel here helpful. Dr. Seth, Psychologist.